Hey guys, welcome back to another episode of Nerdy NP Car Chat. And in this episode, we're going to be discussing SGLT2s and their impact on heart failure. So, as you know, SGLT2s are actually an oral anti-diabetic agent. But in this case, we're going to be discussing how it impacts heart failure and how it reduces heart failure symptoms. And to understand that, we have to understand where it works in the kidneys and what kind of impact it has. So I have this little graphic here. So as you can see, this is a picture of the proximal convoluted tubule. Over here you have your luminal side, and over here you have your basolateral side. This is the side that's closest to the blood, and this is the side that's closest to the urine. So the proximal convoluted tubule is actually one of the tubules in the kidneys. That is where the filtrate goes as soon as it leaves the glomerulus. So as you can see on this side of the PCT, you have your ATP sodium potassium pump. Now, as you probably know, ATP is adenosine triphosphate. It is a type of energy, and it operates this pump here. So ATP goes in, and because of that energy, you get 3 sodiums pumped out into the blood, out of the cell, and 2 potassiums pumped in. Now, this creates a gradient. So basically what that means is there is less sodium inside the cell than outside the cell, and vice versa for the potassium. So because of this gradient, that's how this SGLT2 co-transporter is then able to function. So because you have this gradient, the sodium gradient, where you have less sodium here than here, that allows this pump, this SGLT2 co-transporter, to pump sodium down its concentration gradient from out here to inside the cell, down its gradient. And because of that, it provides energy to pump this glucose against its concentration gradient. And so as this happens, you get reabsorption of glucose and sodium into your bloodstream. So about 90% of glucose is absorbed this way. Now, what an SGLT2 inhibitor does is it essentially closes off this channel. And so now, instead of this sodium and glucose being pumped into the blood, it actually goes and is excreted in the urine. And so you end up with this diuretic effect where you're getting fluid off and you're actually peeing out all your glucose and you're peeing out your sodium. And because of that, water follows glucose and sodium, so you get this natriuresis diuresis effect where you're losing water, glucose, and sodium in your urine. And so this lowers blood pressure, this lowers your preload, and it also helps with weight loss reduction and better diabetes control. And as we know, diabetes is one of the major risk factors for cardiovascular disease. So by decreasing your glucose and getting a better control of your diabetes, you're actually improving your cardiovascular risk factors and your risk factors for developing heart disease and heart failure down the line. So it is beneficial in many ways. One is the blood pressure regulation, one is by the diuresis, natriuresis effect, and another by controlling your blood glucose levels. Additionally, SGLT2s have been notoriously associated with weight loss, which, as we know, obesity is also being, one of the major risk factors of heart disease. So weight loss in itself lowers your risk. And additionally, we don't precisely know how, but SGLT2s have anti-inflammatory properties, and the release of cytokines and other inflammatory molecules actually potentiates heart failure symptoms and can cause more endothelial dysfunction in the heart as well as fibrosis. So by starting someone on an SGLT2 inhibitor, you're actually lowering those cytokines, those inflammatory mediators, and helping with your heart failure. Additionally, SGLT2s increase what we call erythropoiesis. So erythropoiesis is actually the development of more red blood cells. It increases the erythrocyte mass. And what that does is that increases oxygen carrying capacity and improves oxygen to cardiocytes, myocardiocytes, the heart, and improves heart function, and essentially those are the reasons why SGLT2s have been now added to the guideline-directed medical therapy for the treatment of heart failure. So in the next lesson, we will be focusing on loop diuretics. So I hope you join me in the next episode, and subscribe and like below if you enjoyed this one.